Kiraga, who is the head of data science program at the APHRC, that is Africa Population and Health Research Center. So who is also a partner in this study. So let me go straight to the Dr. Modi to give us a welcoming remarks, and then I'll take you through the PowerPoint presentation just to give an overview of the study. Thank you. Welcome, Modi.
Thank you so much for that introduction, Charles. And hello, everyone. It's really lovely to see so many of you at this webinar. So as Charles says, I'm Modi Motsama. I'm Head of Capacity and Field Development at the Wellcome Trust. And the reason why we're supporting this consultation that the APHRC and ARINA are undertaking on our behalf is because climate change is a really big challenge, which is going to affect us all. It is already affecting us all in particular. In the African context, we've seen increases in cholera outbreaks as a result of flooding and cyclones in countries like Malawi, Kenya, Mozambique. These increased extreme weather events are due to climate change that's already taking place today. They're leading to health impacts, putting stress on the health system, reducing productivity and livelihoods amongst people, and just increasing suffering as well for people. And the solutions to tackling the floods or preventing them where possible really requires a whole of society response. For instance, you need the collaboration of those who are responsible for working in land management, those who are responsible for water and sanitation to collaborate, those who are responsible for livelihoods, particularly where, for instance, farmers have lost crops as a result. Also, those who are responsible for food and nutrition security, as crops are destroyed and food it becomes more scarce as a result of cyclones. So that's one of the reasons why we really want to understand how can we, through our investments, guide research which identifies those solutions which can support tackling climate change in ways that protect health, but really in ways that also foster that cross-sector collaboration that's required across those different stakeholders. So I'll just tell you a bit about Wellcome. For those of you who don't know us, we're a research funder, and we use science to solve the world's global climate challenges. And this program of work is particularly being funded by the Capacity and Field Development team within the Climate and Health team. And within our capacity and field building team, we really want to further catalyze the climate and health field in Africa and beyond. And this means focusing not just on researchers, but then also really ensuring that our investments bring together researchers with all the other stakeholders in the wider ecosystem. There's policymakers, the decision makers, the NGOs, the advocates, the affected communities, the public, the communications experts, all of whom are required and whose collaboration is required to help put health at the heart of climate action. We also want our investments in Africa to respond to African-led priorities. Hence, we're consulting with stakeholders in Africa to really understand, from your perspectives, how can we help through our investments to help? How can we help you to really help put health at the heart of climate action? And so the other thing we want to do, I'll end on, is really ending these silos in the way funding happens. So hopefully the way we invest will not just focus on supporting researchers, as we've traditionally done, but then also support those other decision makers, the NGOs, the advocates, to collaborate with those decision makers. So when the evidence is produced, they're ready to use it and take it to help go and make the case for action to the governments or the private sector or whoever it is that needs to take that action. So today I'm really looking forward to hearing your thoughts on how we can better support collaboration across the different sectors in research, in society, and also within civil society as well. And I'm looking forward to hearing your thoughts. So thank you very much for joining. Back to you, Charles. And yeah.
Thank you. Thank you very much, Modi, for that open, welcoming remark. And one very key thing is, how do we put the health at the heart of climate action? So let's reflect on that as we engage in this webinar. So please, Emily, please share the PowerPoint so that I can go through, and then we transition to the panel session. And in the panel session, we are going to focus on the key barriers impeding integrated climate and health research and action at different levels, and opportunities for addressing them from research, policy, and also academic perspective. So thank you very much. From the literature so far, approximately 25% of the global morbidity and mortality burden are attributed to environmental factors, with the magnitude anticipated to increase in the coming years. While a framework such as the 2010 Building Resilience Against Climate Effects, that the PRAISE exists, that is meant to facilitate public health and involvement in climate change adaptation, the elements that influence the adoption of integrated climate change and health program are still not well understood. And also this one reflects from the Africa's perspective, where we equally several national adaptation plans have been formulated since 2007, and their roles underscored, though have not been effective in achieving their intended goals. So how are these plans in our respective countries? Do we engage with them? Next. Emily, put it on maybe PowerPoint presentation form. So this webinar, the objectives include to determine the key barriers impeding the integrated climate and health research and action at the different levels. For instance, at the policy level, practice level, and knowledge level. And that is why you look at the composition of our panelists. We have got from the policy, academia, and also in practice. And also, secondly, is to identify the root of these barriers. For instance, the institutional issues, organizational issues, and other barriers that will definitely bring on board based on this conversation. And third objective is to identify opportunities for addressing these barriers in the short and long-term run, and ways in which these opportunities can be harnessed for action. And we talk of harnessed for action is really linking the health and climate action. So proceed, Emily. So Jambe Modi, because she has already opened for us. So in our keynote speech, we are going to have Dr. Philip Osana, who is the Center Director of Stonecroft Environment Institute based in Kenya. And he has got quite vast experience in the area of environment, climate change, and also public health from air quality perspective. He is a renowned scholar also, and also a really champion in terms of linking research and climate change. Let's go to the second speaker. Emily, please move to the second speaker. Our second presenter is Professor Wilkista Muturi. She's a professor of environmental health at the Egerton University. This is my university for undergraduate and Department of Environmental Science. So she's my former lecturer from 2000 to 2005, and she has PhD in environmental science. In addition, she has professional training in epidemiology and medical statistics from the University of California, Davis. So she's bringing in the academic perspective, again, from environment, but also linking with the health. So there is an opportunity to listen to her, especially from academic, and also how to transition from research and practice. Let's go to the third speaker. Mr. Penson Simba is a global public health and climate change specialist, currently working as the head of program management unit for the Africa Activist for Climate Justice Consortium. He is also the lead climate and health unit at the Pan-African Climate Justice Alliance, where he provides strategic leadership and direction to Pan-African Climate Justice Alliance climate and health program work in Africa. And I know Benson is behind the Enunciate Actors contribution to the Africa's position at the Africa Climate Summit, and really catalyzing the contributions and mobilizing the nurse actors' positions towards COP28, and especially presentation at the Health Day at the COP28. Last presenter. Emily, move. Yes. Dr. Agnes Kiraga is the head of Data Science Program and Research Scientist at the Africa Population and Health Research Council in Nairobi. So APHRC is one of the partners working with ARIN to implement this study. She previously worked as the head of statistics and data management at the Infectious Disease Institute, College of Health Science at Makerere University in Kampala, Uganda, and she has PhD in statistics from Makerere University, from Uganda and Indiana University, based in the US, and a postdoctoral certificate from a fellowship at Johns Hopkins University. So Dr. Kiraga, she's bringing in here from an introductory, from a bio, more of a data experience, but of course, she's going to link it and respond to the question from the policy perspective. So with that, we are going to share about the presenters. So we like to proceed immediately to Dr. Philip Osano to deliver a keynote speech. Dr. Osano, please take it over from there.
Good afternoon, Charles. Can you hear me?
Yes, you are audible.
Good, and thank you for the invitation. I was actually wondering when you're introducing yourself and Professor Muturi, whether there's a conspiracy to get Egertonians to dominate this.
It's a coincidence, yeah.
Yeah, because we all have certainly been in the same department, which is the environmental science department at Egerton. So that's quite something good to know. So thank you so much again also for the invitation. I think I was quite pleased to see the focus on looking at barriers between integrated health and climate research, because I wouldn't say that I'm an expert in health systems or health issues, but I do work quite a lot and extensively on climate change matters. So I think my intervention today would be just to draw upon the experience I have and point out a few key points that we might want to reflect upon as we see how to bridge this gap that we see that's existing. I would start by just pointing out that the first issue that I see in this space is, when we come to climate change, we normally look at it from the perspective of either mitigation, which has the intention, of course, to reduce greenhouse gases and other short-lived climate forces, or adaptation. As I see it currently, I think most of the health implications of climate change in Africa would be on the adaptation side. But I also do see, of course, some commitments from the health sector around also, getting to reduce emission that would come from the healthcare system. So that's number one. So I think that is a direct connection, because if the health sector, like any other sector, has to contribute to climate mitigation, then of course we have to look at how the health system works. We have to look at the waste management. We have to look at, and I want to point this out because it's something that I've seen quite prevalent, which is the incineration systems in the medical facilities. If you look at the incineration system, they are very inefficient. They are suboptimal. They are actually contributing a lot to some emissions, and that's not something that's obvious, but something that we need to take into account. Number two, when it then comes to how we look at health considerations in adaptation, that becomes very important. What I see, and I work a lot sometimes with people in the health sector, and when you look at, for example, non-communicable diseases, that's where a lot of environmental determinants of health is kind of considered. When it comes to, for example, pollution, and climate impacts and so on. But I don't see that being taken sort of general, not just climate change, but they all focus on environment. When you look at across Africa, you look at countries and you assess now the non-communicable disease strategies or plans, you will find that to be in the ones that I've looked at to be a few paragraphs or a few pages of a 100-page document or something like that. And you find that if you look at the way these are developed, there's insufficient engagement or insufficient sort of engagement of people that work on the climate sciences side. It's mostly of people that work on public health, people with expertise in terms of medical health and medical sciences. So I think that's one thing that I would then point out. But I wanted to point out that the key issue there then becomes that when you look at the atmospheric science, climate science work that we do, and when you consider how that work then impacts on health, we in the climate sciences tend to work a lot with modeling, and we do model data on emissions and impact on health. But there are very few studies that actually really work with clinical data, for example, because those, of course, take longer time to collect, but also because of that disconnect between the work that goes on in the climate sciences and in the health kind of research. You only find a few cases where, like I think we had from Watsama about cholera outbreaks or malaria. We are seeing sort of those kind of studies. So there are only pockets of studies here and there, and those are based either on maybe some particular interest of funders or particular opportunity where there are projects that exist that can facilitate that. So I think that integration around data that combines, of course, biophysical data, climate data, clinical data, and then start to make opportunities around finding the implications or impact of climate change aspect, like temperature change on different groups, on mobility, on mortality, on vulnerable groups like women, children, and so on, would be something that we want to think about. Number three is something that, again, maybe it's not new to this to colleagues that are in this webinar, and maybe the work that you're doing in terms of this consultation. But the lack of transdisciplinarity in a lot of projects, whether they're climate projects, looking at health implications, or the health projects looking at the impacts of climate change, is another barrier that we need to overcome. We need to increase and support and encourage and fund more interdisciplinary approaches. I'm saying that because currently we are having a very short pilot study with Professor Manasi Kumar, who is based at the University of Nairobi, on looking at the impact of climate change and environmental problems on mental health, looking at adolescent girls in Nairobi, in Kenya, and in Kilifi. And that project, I like the way it's been designed. It's a short project, but it has, we have people from the medical department, we have people from the climate sciences, we have people from the Environmental Management Authority. It's really almost truly very interdisciplinary. You have lawyers, you have people with all sorts of background that can then help really understand, even urban planners and so on. And I think I rarely see those kind of studies. So I'm looking already at what we come up with, but it's already turning out to be a very interesting project. So I think the point I'm making there, Charles, is transdisciplinarity should be almost the starting point for any kind of research that would like to look at climate change and health. The other thing I wanted to suggest also is what I'm calling community of practice. So currently we talk about, we have generally, when you look at whether it's in the research side, and I'm sure my colleagues that would talk to policy or talk to kind of practice would associate with this. So we have well-developed community of practice, for example, on climate. I mean, for us, of course, on climate, you know that we have the IPCC community. We already right now talking about how we want to work on the IPCC 7th assessment cycle and how we want to sort of like mobilize how Africa can much better, engage in that process. And then you have a community of practice around the health sector. I talked about the non-communicable diseases, for example. So we have a very strong non-communicable disease alliance, which is a worldwide alliance, and they have chapters at the national level and regional level. And I've had the opportunity, of course, to talk to colleagues from this NCD alliance, and I see that there'll be a lot more richness and value in terms of connecting the NCD alliances and the climate science community in terms of research. So that's something that I think should come out as a recommendation. But also at the policy level, I'm sure colleagues at the policy level will speak to this as well. But of course, we know at the African level, we have the Libreville Declaration. The purpose of the Libreville Declaration is really to bring a closer collaboration between ministers and ministries responsible for environment, most of whom then deal with climate change, and ministers and ministries that are responsible for health. So coordinated on the health side by World Health Organization, and on the environment side by United Nations Environment Program. So at the policy level, there's already sort of like this kind of action plan at the African-wide level. We should be mirrored, of course, at the national level, and there are already guidelines on how that can be done. There are already sort of like examples of some countries where this has worked well. And lastly, I think my last point is just to say that at the end of it all, integrated planning would be one way for us to realize this. And I just sort of by way of giving examples, if I take the case of Kenya currently, I serve in the steering committee that is advising the development of the national strategy for climate change and health, which is being spearheaded by the Ministry of Health. And I think so with this kind of strategies and action plans, we do know, of course, that once they're developed, then of course it's an opportunity for national governments or even subnational entities that are doing, whether they're city level, can then allocate funding and allocate resources, including expertise and technical groups to see further implementation. And I think if those technical groups are designed to be transdisciplinary, as we talked about, then we can achieve that integration in both practice, but as well as research. So I think I would stop there because I just wanted to point out some key things based on my own experience. I'm sure as we go along, a lot more different perspectives and it will build on what I have shared. So back to you, Charles.
Thank you very much, Dr. Osano, for that keynote presentation. You have brought in, I don't want to repeat, but you have brought in, especially looking at it from the adaptation perspective, and I think it's been captured especially towards COP28. But one of the key points, the last point around the committee that you are chairing, looking at the developing a strategy for climate and health, this is a question maybe I have for you, and then I'll go to the questions that have been posted so far, is how is the work linked to the NDC? Is it looking at raising the ambition or operationalizing the health perspective within the NDC? Because that will be very important if it comes out as a strong point, because that is already a reporting framework for the national governments in terms of commitments. So the next, already we have one question from Dr. Taylor, that is the Executive Director of the Africa Research and Impact Network. He's asking, does transdisciplinarity simply means bringing researchers from different fields together? What actually defines a transdisciplinary team or research in the context of climate change and health? And I think, Dr. Osano, you already highlighted that. So Emily, who is our colleague, has already shared a Mentimeter, and I request every participant, delegate present, that you click on that Mentimeter and then you respond, share your perspectives so that we can have these comprehensive contributions from all of you. So and the question that I think being shared for those who are still struggling to access the Mentimeter, if you have a challenge, you can alert us with Emily. Yes, thanks Emily. Thanks Emily for sharing the question. If you have any challenge in accessing the Mentimeter, you can alert us so that we can see already Ezekiel Cordon has also shared. So the question is, what do you consider to be the primary barrier to integrated research on climate and health in Africa? Already Dr. Osano has given us some of the key examples. For instance, the work that is going on in Kenya, and everything is already co-leading. So it's a great privilege that we also get the perspective from other African countries, because I see they are quite diverse, vast representation of African countries and also organizations. So let's take the few 5 minutes, we respond, and then we look at the responses. So as you respond to the question, I have Professor Wilkista Muturi, who is the Professor of Environmental Health at Egerton University, so that you come in and you respond to the question on this: what are the key barriers impeding integrated climate and health research action at the different level, and opportunities for addressing them from a general perspective. But of course, you are from the academia, and you can provide that perspective. So from the responses so far, Emily, you want us to share the Mentimeter, or we proceed to the? Yeah, it's good. We see some of the questions, some of the responses, and then also post some of the questions right on the chat. So we are looking at one of the key primary barrier to consider is the siloed approach to climate and health work, which I think Dr. Osano actually brought in that very clearly around the community of practice that is already special focusing on climate through the IPCC work, and also the non-communicable diseases. And there is need to bring these two community of practices together, but also tying to the question that Dr. Atela asked around, does it mean bringing these players or these actors together, or what actually define bringing them together, you know? So the other key barriers that are emerging are collaborative challenges, capacity building, that we need opportunities to build climate and health researchers, e.g. masters and PhD scholarships. That is a very key primary barrier in terms of building the human resource skills and capacity in Africa to really support the integrated approach. That will be inadequate technical capacities in countries predominantly in the global south. Yes, that is already tied to that common contribution on there is need to design masters and PhD scholarships that really looking at those health and climate change. Funding, of course, this is one of the outcome of the Africa Climate Summit. And of course, the discussions towards COP28 and at COP28 is a question around catalyzing, especially climate and health-related research funding. I think this is the first time the Health Day is going to be hosted at the COP28. And I think most of the questions around financing will emerge. So inadequate awareness of connection between climate change and health. Yes, I think already Dr. Osano has brought in around the need to bring this community. So you are raising the awareness. So how are we packaging the health awareness, climate change awareness, and put them together so that you can have that coherence in communication and translation of knowledge, and also the communication package. Funding, yes, that is already highlighted. lack of holistic approach to climate change research, need interdisciplinary awareness. Yeah, that is a very key point. So you can still expound in terms of how do we really go about it? And then holistic approach knowledge, in knowledge dissemination, insufficient resources. I think there are two key action points. So thanks a lot as we continue to, because of time, let's shift to listen to Professor Wilkista Muturi, who is the head of, who is a professor of environmental health at Egerton University. Prof, please come and respond to that question around identifying key barriers impeding integrated climate and health research and action at the different levels and opportunities for addressing them from a general perspective, but at least don't restrict yourself because you are from the academic field. So please proceed, Prof.
Thank you very much, and welcome everyone to my presentation. I'm happy to link up with professionals from all over Africa and some of my students who have presented before me. I'm grateful and thankful for having been invited to this webinar. I've already been introduced, so I don't want to belabor that point. And I'm going to give my presentation from the perspective of academics. And of course, we also do a lot of research. So I'll be, as I proceed, as I give my examples, I'm going to draw upon experience based on what we do at the university. So I just wanted us to have a common understanding of, from the perspective that I'm going to give my presentation this evening, depending on where you are watching from, just to have a common understanding on what we are talking about from my perspective in integrated research. Because looking at what integrated research is, then there are some key aspects that we expect integrated research to have. It has to be holistic in the sense that there has to be a holistic understanding of whatever problem that is at hand. And in this case, we are looking at climate change and health. And since there are so many issues that are related to climate, there are biophysical issues, there are social issues, and all these are complex. And they are occurring already in a complex world that has many other aspects that you are considering, not only climate change. And yet, in integrated research, you need to understand all these complexities. Yes, it is very easy to talk about integrated research, but how easy is it? Because everyone is in their own space. They are doing their own work in their own way, you know? If it is disciplines like in academia, people are in their silos, they are doing, or they are studying and mastering in their discipline. These have to come together because all these are interrelated. When it comes to issues of climate change and health, we have the social aspects. So when it comes to human relationships and even relationships of all these aspects that influence climate change and all the possible outcomes based on what is happening on the ground, because you don't control what is happening on the ground. So it means all this, it forms a complex, it is a complex enterprise, and we have to deal with it. And also thinking about integrated research, then we are looking across boundaries, because climate change is occurring across the world. Of course, it is presenting in different ways in different geographical regions, but yet we have to transcend boundaries geographically, different time regions, and of course, those who do modeling, there are changes that are bound to take place when it comes to different times, even of the year, and even as you project on what is going to happen in years to come. So in that aspect, that is how I look at integrated research. Also, it is a means to an end because it helps us to understand this complexity. I was looking at some of the comments as people were responding to the question that had been posed, and I was getting amazed that even some of the aspects that were being mentioned are actually contained in my presentation. Also, we are looking at a kind of a facilitation that requires people to come to a consensus on what the real issues are, so that when you're undertaking research, you're coming together and collectively maybe defining what the problem is at that particular time. And you know what research questions you're going to tackle and where you want to move, looking at the end, but also trying to move backwards, you know, so that you can put in place strategies in order to achieve that end that you've already seen, that you've already visualized. And then also because this is a kind of strategy where people are coming together from different disciplines and different levels, then everyone has an equal opportunity to influence that process, to even influence the outcome. And then because people are from different disciplines, different backgrounds, they have different experiences, then there are these multiple perspectives. There are these diverse types of inputs that are being brought in. And these diverse inputs are likely to also yield diverse outputs that have to be put together, that have to be packaged together in order to come up with a favorable outcome. And all this happening such that it is visible to those who need to see what is happening. It is open enough for everyone to come on board and contribute what they need to contribute. And of course, traceability. So it is from this perspective that I'm coming from when I consider what this kind of research is all about. Is it to say that nothing has been happening? A lot is happening. People are doing a lot of work. There's a lot of research when it comes to this field of climate change. In fact, it is cross-cutting. So in all disciplines, you'll see people mainstreaming or integrating climate change. So there's a lot going on. And for a long time, this has been going on. We are seeing a lot of conferences, a lot of workshops, you know, at all levels. Now we are moving towards COP28. So there's a lot going on when it comes to these conferences and workshops. There are a lot of meetings going on. Recently, there was one in our country at all levels. We are seeing alliances that have been formed that are dealing with climate change. Policies have been formulated, you know, to be able to see how to mitigate issues of climate change. Coping strategies. Right now, we are experiencing in Kenya the El Nino phenomenon. And we cannot rule out the frequency of occurrence of this phenomenon in relation to climate change and other aspects. Of course, of the environment and whatever that is happening, since, you know, this is all integrated. So a lot is happening in this space. But then we are seeing more impacts. There are more impacts being experienced whenever there are climate change related occurrences. Impacts to people, impacts to infrastructure, and whichever elements that may be at risk. People are affected a lot. We are seeing more geographical regions being affected that were not much affected previously. And you know, all this research is occurring in silos. We are not seeing health really coming in because people will talk about climate change, they'll talk about the impact, but it's not coming out so much how it is, you know, health comes in. And for a long time, even when primary healthcare strategies were being put in, it was very, very much compartmentalized. such that you don't see issues of environment being brought in. You don't see other social issues being brought in. And now health is a very big, it has become a monster kind of in quotes, because now we have post-COVID, we have mental health. And post-COVID, we are seeing now a lot of environmental aspects coming in of hygiene and sanitation, because COVID brought out some very pertinent issues when it comes to health. And I think now people are beginning to realize that really health is in the middle of it all, because everything affects us in one way or another. Because if it is nutritionally, if it is crops that are destroyed, then if we don't get enough, our health is going to be affected. If it is our livelihoods that are affected and we cannot be able to make ends meet, our mental health issues are going to come to the forefront. And all this, and that's why now we are seeing a lot of emerging disciplines like One Health and planetary health and things like that, because now there's a realization that health is at the center of everything else that we are doing as human beings. And the environment has not been left out, because the environment is actually everything. Coming to now to the main question and the main focus of this webinar. What are the barriers to IRA on climate and health? So from my perspective as an academician and as a researcher, we are seeing that these ideological beliefs and holding certain worldviews, sometimes it hinders dialogue. When we are doing disciplines across geography, research, when we have collaborative research across continents, you find that sometimes dialogue becomes a problem. There are those from other parts of the world who may want to talk down at you. Maybe they feel they know more, whatever they hold, beliefs they hold, maybe they feel they are more superior, and they are not willing to yield ground, such that others can come in and bring in their views, such that now sometimes it becomes just one direction, one way of thinking. So you could be saying that you are doing an interdisciplinary or multidisciplinary or cross-disciplinary, whatever that you may want to call it, because it has so many aspects of it. But at the end, it is maybe one or two persons whose ideas are being followed, or whose ideas are being put into perspective. So sometimes these ideological beliefs, it becomes very difficult. And especially if you are the one who has the past. Maybe it is your country that is bringing the funding, and especially from the West. Sometimes that becomes a problem. And sometimes it even brings conflict. Also, you have individual personality. People are different. People are different. They have different predispositions. Skills. People have different skill sets. And even in different interests. Why am I coming into this research, for example? What is in it for me? So sometimes these personality traits and maybe lack of skills, or sometimes even maybe people have the same level of skills, but maybe they fail to recognize weaknesses. They don't want to acknowledge that there could be weaknesses that they can bring in. Even those people who appear to be less skilled than them, but maybe they have something that they can contribute. So sometimes that brings a problem. What about teamwork? Teamwork sometimes becomes a big problem. You want to do a proposal, you have formulated a group, but people cannot work as a team. Or even people in a team, they are not working hard enough, and you have to submit these proposals, and you have to write these reports. You find that maybe it's just a few people who are doing it. So sometimes team dynamics come in when it comes to this kind of research. And sometimes there's failure to establish the required agreements if you need to be able to operate effectively in this space. What about organizational barriers? because these are people from different organizations working together. Different organizations have their own practice. A lot of bureaucracy, especially in the government-related organizations. Who is to sign this MOU or this agreement? And the MOU takes so long to sign. Some people even give up. What about which institution is going to receive the funds, to administer the funds? How do you access the funds? You know, so all this bring about problems, these organizational and institutional barriers. And sometimes it becomes a bit problematic and it hinders the progress. Sometimes even you are caught up with time, you are not able to make good progress on time, maybe you are lagging behind, so it becomes a bit problematic. I saw already lack of resources or lack of funding being one of the reasons. And of course, this is a big problem because who is giving the funding? If I'm the one giving the funding, I'll set the agenda. Maybe I'm going to give requirements and you have to meet these requirements. Where does most of our funding come from? So you find that since the different funders have different agendas, and you have to tweak your proposal to be able to meet some of those requirements. Sometimes it hinders you as a team from achieving what you would have achieved should you have been left to set your own agenda, you know, in quotes, kind of. So whoever has the past will dictate what you are supposed to do. And you find that even for local funding agencies, sometimes it's a 3-year funding like NRF. You are funded the first year, second year, the third year funding is not forthcoming, for example. That has happened a lot. So you find that you fail to meet your objectives and you have to curtail your research at some point because the funds have run out. Compartmentalization of research. We are doing that a lot because we tend to be very, to hoard kind of, and we want to bring on board maybe people in our disciplines, people we have done research with together, and we want to just do research in silos. And that's like, that's why I indicated that for a long time, health was not linked to other disciplines. So it is now good because most funding agencies will tend to ensure that they put the requirement of being multidisciplinary or transdisciplinary, interdisciplinary, whatever that you may want to call it, such that now with time, these silos are you know, they are reducing. The compartmentalization of research is reducing. Otherwise, for a long time, this was a big problem. And then in the university, we have a lot of work going on with our postgraduate students. A lot of research has been done. It is on the shelves. If you go to the library repository, even online, of many universities, you'll find a lot of work, abstracts for work that has been done. But then, how do you translate these research findings that are on the shelves? How do you put it into action? Whose business is it? In the university, our work is to, once we generate the knowledge, we may just do a bit of extension here and there, maybe to surrounding communities and maybe those whom we have collaborative activities with. We may go to conferences and present and workshops, but that is where it ends. So who is supposed to put or to translate that into action? For a long time, we have been talking about this, but really we are not seeing progress when it comes to translating the research finding into action. So from my perspective, from the perspective of the academics and the research that we do, these are some of the experiences that we have from the university. So it would be important to hear what experiences the other presenters bring from the different sectors. Otherwise, thank you very much, and I welcome questions. Thank you.
Thank you very much, Prof, for that comprehensive presentation. I don't want to really go back and do a recap of what you have shared, but some of the key cases which are already emerging, which is likely practically, is at the African Climate Summit, there was a communication that Kenya is going to face El Nino. And I was in one of the sessions and I wrote it in my notebook. But we saw that after that time to the time now we are experiencing, or the government has acknowledged El Nino, there are a lot of things which happened here around the policy and practice around policymakers having that question around is when there was delay of the rains, that we have to really announce it as El Nino again, or it's like El Nino might not come. But already we are looking at the flooding, and already quite impactful in terms of drowning and displacement, or especially from the eastern part of Kenya. And I think now Somali is also area that is going to be affected. So what is the implication in terms of health from one, the inaction from the presentation, from the announcement, and the discussions around do we have to take action, and the question around where are the resources for the subnational government, for instance, the county governments in Kenya, to act on the impacts of this flooding now that is happening, that is likely to lead to health-related issues. So that is a very practical context that for especially Kenyans who are going to the COP, that is what we need to reflect on, and of course in this particular session. Another key point, only two, so that I don't want to really do a recap, is the complexities around multiple perspectives. How do you address, especially harmonize these multiple perspectives from the different disciplines, so that we can narrow down towards having the committees, which Dr. Osano has initially indicated that in Kenya, they are working on the climate and health strategy, bringing together different community of practice or committees from the climate and health. How do we really harmonize this perspective so that we can have an outcome that is integrated and really capturing the aspiration around really having a strategy that is going to facilitate the actors and the funders and also the communities at the local level to act on developing health resilient systems. So please, let's build on Prof's presentation by responding to that question. Click on the Mentimeter, as it has been shared by Emily and Ezekiel. I've seen some delegates not managed, but we can still share. I've shared with some of you who have already indicated that they could not on the individual message. So what are the challenges? What challenges do governments and policymakers face in integrating climate change and health considerations into policies and programs? So already we have got 3 responses: that competing priorities. We already have health emergencies that we are struggling to deal with. Perception, especially on climate change, is not viewed as health issue. Let people at the environment deal with it. So the already Professor Muthuri has brought in, especially the perception, but now there are multiple perceptions from the different disciplines. And again, let's think about the question that Dr. Atela did ask: what does it entail when you talk about transdisciplinary? And then again, the second contribution is lack of comprehensive knowledge on impacts of climate change on health by country context. Very few countries have done their vulnerability and assessment. Go back to the years, so they don't know where to focus their attention. And I'll share the experience here from my perspective, and also the team. We have been engaging in multidisciplinary research. If you look at the vulnerability and assessment tools that we have so far on most of the data, there's a database which had 719. And these are most of the tools, they've not gone beyond piloting phase or beyond the project period. So how do we, as different disciplines now, as we struggle from climate change and health perspective, how can we co-develop a vulnerability assessment tools that will really facilitate the integrated approach from data defining concepts, data collection, to analyzing the data and really co-developing evidence for policy and discussion and developing health programs and that are resilient. Capacity building, target high-level policymakers in the health ministry to build knowledge on why climate change is an health issue. For the actors or delegates coming from Kenya, I'll ask, recently the government of Kenya deployed the community health workers. And I was asking myself, because I've met a number of them in our estates or on the community level, do they have that skill in terms of responding at the health issues of the community, putting into consideration the El Nino impact? And this one brings in around when government is deploying also both the policy and the practice and the programs and the skills, what are the levels of capacities when it comes to now integrating, looking at health from the climate change perspective? And also this one raises the question of the policies at the subnational level. For instance, a number of countries now are adopting the devolved function. For instance, in Kenya, we've got the 47 county governments, and they are autonomous. They have the authority to develop policies and programs and legislations at the subnational level. But do they have that capacity to really develop these integrated policy frameworks? The other key point that has been raised is lack of agreement among the public that climate change is real, misinformation about climate risk. So it is around now demanding the question or the methodology around visioning exercise, where the risk or the policy bundles are agreed upon by the different actors. But what are the tools that are going to use, especially to ensure that we address the lack of agreement or facilitate the agreement on key issues, or from risk definition, from risk, the metrics for measuring or identifying the evaluating programs that are addressing the risk within the health sector, and also the policy bundles all the way to really addressing this misinformation. So thank you so much. So proceed. If you have got a burning question that you would like to ask this particular juncture, you can raise your hand so that we transition to listen also to the last two speakers who are going to focus on the policy perspective. And of course, Benson is going to bring in especially the civil society, the advocacy question, and the capacity among the non-state actors. And Dr. Agnes from the APHRC is also going to really share with us from the research perspective. So if you have got a burning question, you can raise your hand. You go to the reactions and raise your hand, and let me give you around 2 minutes so that we see any hand. Please proceed.
We have a question in the chat.
Anybody who would like to so that we can give you the microphone. Okay, so you can still reflect, you still have also time so that we can give you the opportunity to ask the question as you also type. So let's move to the fourth speaker, that is Mr. Benson Zimba, who is the Global Public Health and Climate Change Specialist at the Pan-African Climate Justice Alliance. This one is a network of civil society organizations across Africa and quite instrumental in mobilizing the non-state actors, particularly towards these regional discussions and also the global discussions like the COP28. Benson, if you are ready, please come forward. You have 5 minutes to share your presentation so that we can have the last few minutes for reflection.
Okay, thank you so much, Dr.
Okay, thank you.
Yes. Okay, thank you so much, Dr. Tonu. for having me, and also that we may share a bit of our perspectives around climate and health work, especially from a policy perspective and what we are seeing currently around Kenya and also the rest of the world. I think you've already alluded to part of the work that we do as civil society, especially in this very critical area of climate and health. And perhaps part of the latest conversations that I think where this subject was conversed was in the recent, African Common Position on climate and health, where we had deliberate focus on exploiting the potential of One Health approach for low carbon climate resilient systems in Africa. And so part of, I wouldn't go into all the details in this position, but I will spend like the next just 2 minutes or so trying to bring out part of what we already were able to pick from these engagements as part of the policy gaps that I think that are important in this conversation. I think Dr. Sano, in part of his, presentation, did speak about how, for example, at the global and regional level, UNEP and WHO are having sort of, collaborations, and also spoke about the Libreville Declaration. So part of the lessons that we were able to learn from the earlier engagements is that there were major policy gaps that were existing, that didn't necessarily, for example, bring on board, the United Nations Framework Convention on Climate Change. And therefore, that policy gap meant that climate and health conversations were not necessarily being discussed in the global platforms, especially at COP, for example. So as civil society, we had a convening in Malawi, where we had representation from over 30 governments in Africa and civil society and donors and all that, and academia, to sort of, look at what is it that is supposed to happen. For example, this year being, a global year for global stocktake at the COP28, we clearly saw that at the COP negotiations, health has been missing in a structured way. And even as we discussed this year on, issues of the global stocktake, it wasn't very clear how the health, targets and metrics look like, within that space. And therefore, that remains a space where we have particular gaps that we need to think about. What is the best way that we can be able to ensure that, health at COP, is able to be to have its rightful space. And therefore, this year, COP28 presidency has prioritized this theme. And on the third day of COP, we'll be having more conversations just to be able to ensure that we contribute more to the declaration on climate and health that is going to come out of, that space. So part of the other, policy gaps apart from the UNFCCC level is really the capacity, to engage at the African group of negotiators who negotiate on behalf of Africa. You will notice that even then, they also had limited capacity to engage in this space, but there were also additional issues that came that even where we have, certain provisions within the UNFCCC articles like 4.1, still the implementation of some of those, policy provisions on mitigation and adaptation in the health sector were also, not being, implemented. I'll just skip quite a couple of those and just move down and focus on the national level, where again, there were obvious gaps in terms of policy, especially when you look at the nationally determined contributions and the national adaptation plans, where while we have many, countries in Africa having been able to do their NDCs and NAPs, and even some have gone ahead to attempt to do the health national action plans, there still remains quite some gaps that need to be addressed in those policy frameworks. And I'll come to that also in a while. So you will see that that African Common Position Statement attempts to speak to some of those gaps and what we need to do. And I saw in the chat box, one of our participants asked about our engagement with the Global North in terms of the policy work that we are doing. I think we still think that Africa is suffering more from the effects of climate change, and we emit too little. And therefore, our policy and our messaging still remains that it's important that we be able to prioritize both mitigation and adaptation in our messaging, with, of course, innovations and thinking of how we can be able to address that from the global south side of things, and also how the cut on emissions can also happen in the global on the global north. That is a bit of just some quick mention on some of the policy gaps that were conversed in that policy statement. But to be a little bit more specific, just to proceed on a few more thoughts, we have also seen, more specific gaps, policy gaps at national level. Like I already alluded to in terms of the national policies. And at the Pan-Africa Climate Justice Alliance, we did a study and focused on, just try to zoom on a few countries like Tunisia, Mauritania, Cameroon, Kenya, Botswana. And some of the key, obvious things that came out from that study just was showing that while, for example, health has been included in the national adaptation plans, it's really done so in a very general sense and not specifically linked to the climate change impact. So in some of those policies, discussions of the link with health are existing, but the correlation to climate change is very weak, or in most cases, not even appearing in some of those, documents, very well. So that is a major policy gap that we need to think about, especially at the national level. And also most of the policies that we were able to look at, it was very clear that climate change issues across all those countries were being overseen, like some of us have spoken to, by the Ministry of Environment, Forestry, Natural Resources. And really, health is not given a high priority in terms of climate adaptation and resilience programs, because most of those programs I basically tend to focus on agriculture, forestry, water, and even environment. Quickly, I also want to add some policy gaps that exist around climate and health financing. I think basically what we have also observed, even from that study and by practice, is that when it comes to climate change initiatives and financing in the countries, there is no direct mention of direct sectoral financing specifically for health, and lack of mentioning in the NDCs in terms of direct sectoral financing, we think is a very critical gap that needs to be, looked at. Again, climate change and health programs lack visibility and direct funding, and this also weakens what I would call, the case for investment, to address, to have interdisciplinary research, for example, to look at surveillance of climate change and its effects on the health sector. As I move down, I also just want to quickly add that there are obvious gaps that we have seen around even at intervention and design of project level. Most of the projects we have seen around Africa still focus on agriculture, land use, forests, water resources, food production. And there are very few programs, if any, that will look at, the focus on health and its interrelated nature with all these other sectors that we are talking about. So that means that from a design level for the interventions, I think that's an angle that where we have a gap. And quickly, just to also add to what you spoke on, I think Dr. Sano and Tonui, is the aspect of vulnerability of the health assessments. How inclusive is that process in terms of the tools and so on and so forth? So for example, in Turkana, I think around 3 years ago, we did a vulnerability capacity assessment when we had the locust invasion in East Africa, when we had the same communities being affected by flooding. At the same time, the same communities were suffering from COVID. In terms of the nature of the vulnerability capacity assessment, how do we overlay that vulnerability and we're able to see the interconnected nature of the hazards that the communities, get to experience, and bring out useful data for research, because you will discover that there is intersectionality between communities that have multiple hazards exposure compared to maybe one of, exposures that sometimes they get to look at. To my second last point, I think part of the barriers that we are increasingly seeing, even at the national level, is limited capacity for anticipatory action for climate and health. I think anticipatory action has increasingly been recognized as a key solution to reduce the impacts of climate change and extreme weather events. And so investments are now happening in that space. But you will see that in terms of some of the national plans, while there have been some mention around, being able to identify, some of these, shocks that the health systems go through, there is no clear system of building anticipatory action. And anticipatory action could potentially focus around, for example, capacity building, forecast-based financing, and so on and so forth. And currently, only 60 countries are really trying to look at how they can do work around anticipatory action. But these are proven solutions that we think that can address part of those inadequacies that we are seeing at the national level. And we are seeing even the GCF currently now getting to appreciate the role of anticipatory action in the national health systems as part of preparing the health systems to cope and address, climate change and all that. So that also then means that the way the research happens, it needs to also take into account some of these approaches that we are talking about, and to continuously inform us how effective they are and all that. Lastly, is the link with the meteorological departments around Africa. And recently, I was in Nigeria and met with the Director General of the Nigeria Meteorological Agency, NIMET, and they have data that goes back to 1897. Part of this data has agricultural data in it, health data in it, and several other sectors that they have been able to collect the data around, which is so rich since 1897 that can inform us, how do we draw the connection? And I think around all these forms of data that we're actually collecting from the environmental patterns and the things that are happening and their correlation with the health outcomes that are of interest. So that is part of the compartmentalization of issues, and that is part of the issues that we also need to look at if we are to address some of those policy gaps, as well as in climate, and research, part of the conversation. So I want to stop here so that I give time for the next presenter. Thank you so much.
Thank you very much, Penson. And I do not also to be tempted to do a recap, but there is one key point that you raised. There is a challenge around direct sectorial financing, and that is missing in the NDC, and that is already a national policy reporting, national climate change reporting framework. So it raises a lot of questions around, if we are not doing that as Africa or as developing countries in the national reporting on climate change, then there will be a lot of challenges around operationalizing the existing policies, because it depends on the voting of those components within the policies. I was engaging with one of the actors from the different, two actors from the both climate change and health, and the question they raised is, if during public participation, the stakeholders voted for a particular component within the plan, then the government will execute as they are voted by the stakeholders. So this raises the question around the different perspectives, the multiple perspectives, and thinking around climate and health, and also going back to the questions around awareness. Are the stakeholders in Africa aware of the agency to really build health resilient systems by looking at it from the climate change lens? So we have got yes, Onweno, please, I'm handing over the microphone to you for the question. Please come forward.
Thank you so much, Mr. Charles. And also thank you so much, Benson, for that wonderful presentation. I have about 3 questions to put across. You talked about the gaps that exist in the framework that you displayed there. And I'm also thinking of persons with disabilities. Is there any policy that talks about persons with disabilities? Because when we are talking about climate issues or climate change, then we cannot handle matters of persons with disabilities wholesomely when we talk about health. We know they have special needs, and their case are totally different from when we are talking about persons without disabilities. Another one, is there a research that...
Sorry, Mr. Ibrahim Nyaburi, please mute. Or, Emily, please help us to mute Ibrahim. Yes, proceed,
yes. Thank you. He also talked about vulnerability capacity assessment. And now when we're talking about vulnerability, I'm also pegging it to persons with disabilities. I think we need to have a research that is purely conducted on persons with disabilities in regards to climate change. Yes. Because, for example, even when it comes to evacuation during disaster, when a disaster strikes, we know persons with disabilities, they face a lot of challenges. Some have underlying conditions, others are on medical care. And then if we don't really have a research that is conducted for them to know some of their needs when for example, doing evacuation, then we might end up leaving them behind and they can suffer more. And then lastly, I would like just to know from Benson, because I believe he has interacted with the framework, if there is a policy that talks about indigenous knowledge, because I think we need to come up with a policy that speaks loudly about indigenous knowledge so that we can harness indigenous knowledge and maybe integrate it with the modern or the scientific knowledge so that it can help us with matters of climate change. Thank you so much.
Thank you so much, Ogweno. I request delegates who have not muted, please mute so that when you're having the engagement, there is a limited disturbance. So you have put out, raised 2 questions around people with disabilities, but also overall, I think we are looking at the engendering this integrated approach when you're looking at the climate and health, and then also from the vulnerability assessment perspective. So I'll give Benson to respond later with regard to that question, but let's proceed to the Mentimeter and look at and respond to those questions. What specific challenges do healthcare professionals face in addressing the health impacts on climate change and health? And one response so far is financing and investment, lack of involvement and full cooperation from the government. So the financing and investment, which already Benson actually brought up around when we were developing the NDCs or even thinking around the review in 2025, to what extent are we going to look at direct health sector financing within the NDC? So that, and also at the planning at the national, even at the local level, because the government implements what also the NACET actors have contributed to, or the researchers, and really validate. So we need to look at the gap that is there is the limited financing and investment on health. Lack of involvement, yes, that is a very key key point building into the previous points raised by Dr. Sano around the different committees, and also Professor Muturi and Modi around really looking at this integrated approach and bringing together different disciplines, but also individuals and clusters of stakeholders. Please proceed to respond to that question as we usher in the last presenter, that is Dr. Agnes Kiraga, who is the head of data science program at the African Population and Health Research Center. Please, because of time, please, Dr. Kiraga, come forward and share your perspective around the key barriers impeding integrated climate and health research and action at different levels and opportunities for addressing them from the research perspective. Be biased on the research perspective. Thank you, Dr. Kiraga. Please. Do we have anybody from APHRC who can alert us if she's having maybe challenge of joining?
Charles, Dr. Agnes has said she'll be sharing her slides. I think she has had some emergency engagements, so she's not able to speak. So maybe I think we're also almost over time, so maybe we could take the final perspectives so we can close.
Okay. So she's not able to make the presentation.
Yes, but she'll share the slides so that participants can see some of the insights.
Thank you. Yeah, thank you very much. And we will share the presentation. So on the last, the third question, please engage and share through the Mentimeter. And because of time, I don't want to make comprehensive remark, but I'll just highlight some of the key points that have been raised. One is on bringing together the different disciplines, the different actors, and already, for instance, there is a case in Kenya where Dr. Osano is already leading a committee that is developing the climate health and climate change and health strategy. So that is a very key concrete case from Africa's perspective, and we look forward to getting also other experiences from other countries. The third key point is on how can we address especially the multiple perspectives which Professor Muturi raised, and so that we could develop a common outcome that will really present integrated climate change and health perspective. And then also from what Penson raised is around financing. Now, before I come to financing, is the integrated planning and linking with the operationalization of NDC. So where do we place especially the planning from the sectoral perspective, but also from an integrated perspective, and really looking at the NDC. And then also financing, which has already been raised very strongly. Yes, financing we need, especially for the climate action, and already there are a lot of commitments, and already the adaptation financing that is already on grounds facilitating actions. Are we going to design especially financing that will be addressing or supporting building of health resilient systems from the climate change lens? And I don't want to proceed from there, but we thank you very much for the perspectives or responses to the questions that we have shared on the Mentimeter. And these are going to really help us in consolidating into a common report and also communication package from the study, which is likely to end by April next year, which is supported by Wellcome Trust. We are focusing on the climate and health linkage, and especially looking at the community of practice. So we look forward to engaging all of you in the next meetings or presentation, and particularly also at the COP28 and at the Health Day. For those who have been following the planning, it's actually the momentum is quite high, and there is a quite substantive actors who are really present. So on behalf of the African Research and Impact Network, African Population Health and Research Center, and Wellcome Trust as our funder, we really thank you. Africa Research and Impact Network is a network of close to 200 fellows across 36 African countries. You can join us, go to the website and apply to be a fellow, and we look forward to engaging with you. So we'll share the communication package. And Emily, do you want us to take a photo or a group photo? Take it over from there. Emily, any logistics around? Okay, I think, yes, Emily.
Oh, I thought maybe we could address a few questions that were raised, but if there's no time, we can take a group photo.
Yes, the time is the factor now. At least we have captured quite substantive. So as we take a group photo, maybe closing remark. I've seen Dr. Taylor and Modi, if maybe one sentence or two as we take a group photo.
Thank you, everybody.
Go ahead.
Okay.
Thank you. I mean, exactly the same. Yeah, thank you so much. Really excellent speakers. I hope I meet you in person at some point soon. But yeah, thank you so much for those contributions, and also everyone else for attending.
Thank you very much. You are all most welcome, and enjoy your weekend. Put on a smile. Are we done, Emily? Emily, are we done? Oh, okay. So let's put on a smile. If you have got your pet, you are taking coffee, tea, you can bring him, or you can bring the dog or the pet to the screen. We all take the photo.
Done.
Okay, thank you very much, and God bless all of you, and let's engage as we strengthen. Thank you to the speakers and also to the delegates, and your responses are very invaluable. So we are going to repackage and communicate later. God bless you, and let's meet at the COP28 for further discussion. Thank you.
Okay, thank you too.
Thank
you.
Bye. Asante.
Thank you. Asante.
Thanks for the presentation.